These are not cavities. This is. Hi, I'm Dr. Yao with DP Dental. Today we're going to share with you what's the difference between stains and cavities. Not everything dark that you see on your teeth needs to be filled. Stains are often superficial. They can come from all kinds of environmental things, such as eating and drinking dark-colored food and liquids, smoking. All of this can cause stains to our teeth. Oftentimes, a simple cleaning is able to remove the superficial stains. Now, if you see dark coloration in the grooves of your back teeth, that might be a different story. So how can a dentist tell the difference between a stain versus a cavity? It's by texture. So when we go in with our instrument to feel around your tooth, if it feels sticky and I'm dropping into something that might be a hole, that's a cavity. That's something we would recommend to fill. Versus a stain is a solid piece of tooth. We may advise you to watch it, and we may give you some oral health instructions so that you can clean it better. So what's the best way to prevent stains and cavities from happening on the back of your teeth? Well, most of us, we have molars with very deep grooves. Deep grooves means that whatever we eat and the bacteria in our mouth may hide among them. When the bacteria and food hides among them, such as when we're eating very sticky cookies and caramels and such, bacteria can keep eating that food and thereby cause a decay in the future. Is there a way to prevent this? Yes. We recommend for children between 6 to 14 years old to get preventative dental sealants on their molars. A sealant is a layer of flowable composite material that we simply clean up your tooth before it has any stains or decay. We wash it, we dry it, we apply a layer of dental sealant, and we cure with a light to set it. That way, we can prevent food and bacteria from falling into those deep grooves. Here's how a tooth would look like after it gets a dental sealant done. Are we able to do this in adults with molars? We can, but oftentimes if we see stains that has already formed, then there's a chance that tooth may become cavitated. Which means oftentimes we might actually recommend to watch it, because if there's a cavity that forms underneath a sealant, we might not be able to keep it in check. Hence, dental sealants are best done between the age of 6 to 14 years old. If you already have stains on your teeth, what can you do at home to prevent it from getting worse? Well, the number one key thing is we limit the amount of time we expose our teeth to food, which means when we eat a meal, it's ideally we can eat it within 30 minutes. We try not to keep snacking so that food is not always getting stuck on the teeth, and definitely at least an hour before you go to bed, before you brush your teeth, avoid eating very sticky food. That might get stuck on your teeth, making it difficult for you to brush it off, and then you might sleep overnight with food in those grooves. Those are high cavity risks.